All right. Awesome. So it's December. We're at the finish line of the race where the goalpost just keeps get moving, because there is no real finish line until we're officially done, which means we're horizontal forever. And that's the only time I think it'll be done. And so I think sometimes there's this, hey, set a goal, achieve a goal, set another goal, achieve a goal, set another goal. And this time of year with New Year's resolutions coming and all of that, it really becomes a popular topic. So we thought Dr. Goldberg and I would discuss just how do you avoid procrastination? How do you avoid falling back into old habits? And really, I think there's a debate about New Year's resolutions that don't work, and how do you create action from it?
So it's interesting. A lot to unpack there. But, so, I know that um, you've studied with John Maxwell,
mm-hmm,
as have I actually.
mm-hmm, mm-hmm,
Um, and I I love being a member of the Cialdini Institute, because what I like about Bob is that he's a scientist. So he likes to measure things. So he's done studies, and I don't have the study in front of me, but he's done studies about the effectiveness of New Year's resolutions. And what he's found is that if you want to increase the likelihood that your resolutions will be followed through on, make it public.
Yeah, a public
So
declaration.
the principles of consistency say that if you say something to other people, you will do everything you can to avoid breaking that self-promise.
Yeah.
So, but I think, you and I were talking a little bit before. As a coach, I am busy this time of year. I mean, I started probably 4 weeks ago, coaching my clients to plan for the next year.
Mm-hmm.
And that process, I think, is important. What I recommend is looking backwards.
Mm-hmm.
First. Look back and ask yourself what's worked really well, what hasn't worked that well, and what hasn't worked at all. And using that as sort of like a jumping point for evaluating what you might want to do in the future.
Mm-hmm.
You certainly don't want to do what hasn't worked. And you might want to do more of the things that really have worked.
Yeah.
And you also might want to look at why things work, but maybe not worked as well as you would have liked,
Mm-hmm.
and what you might be able to do to change things so that they can work better.
To shift it. Yeah.
Yeah.
Yeah. Two things I think about in James Clear's book, Atomic Habits. He talks about that verbal announcement. I think it increased the likelihood of them showing up at the gym by 91%, and went from 33% show up rate to 91% follow through rate. And so we actually use that as one of our preventing cancellations hacks, coaching hacks. So have the patient repeat back to you when they're going to be here while they're looking at their phone. And so there's some truth to this public declaration at the end of our 2-day event. When we have them go through their action items, we have every team sit down and pick just 5 things they want to implement from the 2 days. Tons of ideas, but here's things. And then verbally say to the room, here's what our team's going to do. And we have them do that. And I don't know that they know so much about what we're doing there, but I do talk about, look, this is where you begin the movement. You initiate the movement. You say you're going to do it. You're going to be in that process.
It's commitment. It's a commitment. You're making a commitment. Not when you make a commitment to yourself, it's easy to break.
Yeah. Yeah.
When you make a commitment to someone else,
yep.
Again, depending on who that someone else is
Mm-hmm.
in your life, you're more likely to do it. And the data which is what I like about Bob. The data is clear.
Mm.
So commitment and consistency, really important.
Yeah.
But, and this may sound a little self-serving, um, it's also one of the values of coaching.
Mm-hmm.
The values of
Yeah.
coaching is that you're making a commitment to your coach
Yeah.
and you're being held to that commitment. There's
Mm-hmm.
accountability, which oftentimes is lacking. And without accountability, the likelihood of something happening, it goes down
Yeah.
significantly. So we talked about recidivism.
Mm.
Recidivism is the what happens in normal human behavior. Great example, Oprah Winfrey.
Mm.
So look at Oprah and her weight over the years,
Up and down or whatever. Yeah.
up and down.
Yeah.
Now, why? Because there's a principle of recidivism that naturally occurs.
Yeah.
These are sort of hardwired into our beings.
Mm-hmm.
So, now she's on Ozempic and or something similar. Um, and that takes away that recidivism.
Mm-hmm.
Coaching does the same thing, which is one of the reasons that weight loss happens to have been, Weight Watchers happen to have been a really good program.
Mm-hmm.
They were sort of made to look a little foolish, by Oprah. So now what's interesting is Weight Watchers is actually starting to implement a medical component.
Oh, gotcha. Wow.
Um, but look, every professional athlete has a coach,
Yep.
right?
Yep.
They may be the greatest of all time already.
In their sport, but yet still.
Still have a coach. Why?
Yep. Yep.
Recidivism.
Yeah. You need that accountability. I think the perfect analogy talking about weight is if you were New Year's resolution, and just to stick with that theme, you wanted to lose weight or gain weight, whatever it was, build muscle. I always tell my wife, I'm always in bulking season. So I'm always looking to pack on a few pounds, especially this time of year. So, but if I internally just said, you know what, I think I want to lose 10 pounds. First of all, the way I verbalize that internally, I think I want to lose 10 pounds. It's not a commitment. So how you process is important. I think writing it down first and then reviewing it daily, talking about yourself daily is good. But if I just think about it and then I go 30 days, what are the chances of me just thinking about that and doing it? They're very, very, very low. But if I verbalize it correctly and all of a sudden I say it to Abby and I say, hey, you know what? I'm going to lose 10 pounds. Okay. That's that second thing. And maybe I'm more likely to now do that. However, you have to have that accountability where every single day you check in. And by checking in, that means I step on the scale and I announce to someone where I am. That to me is now increasing the likelihood of you getting there. You can't just internalize it weekly, in a very weak fashion. You have to, state it in your mind repeatedly in a very powerful fashion. Same way to someone verbally every single day with some feedback, with some metrics. What you measure, you improve, right? So now you've got a chance of getting there. So wholeheartedly agree with you. So important.
So I'm curious, what are the more common things that, in your experience, dental practice owners put on their New Year's resolution list?
So we have them do 2 questions. Okay. And they're coaches' questions. They're things that we're thinking about all the time. So question number 1, I have them list out. I say, what would 2024 look like if it were ideal? Just describe that. It's a bit of vision / goals. They're not really thinking about what I'm doing. I didn't say set some goals for 2024. Just what does 2024 look like if it were ideal for you? And they might write, these days it's been a lot of removal of restrictive insurance. That's been a really big one lately. Maybe it could be this time of year. Lately it's been finding a certain type of team member that they're hiring for, expanding their team. They're missing someone. That would be a big one. And then another one often is, a financial goal. I need to pay off these bills. I need to, pay my team more. We need to collect more, whatever it is. Okay. And so then I give them the second question that is on repeat mode, which is, well, what would have to happen to make that possible? And then we reverse engineer it, and they say, well, I'd have to work this many days, or I'd have to, put an ad in here. What would it take to make that possible? Well, I'd have to start having conversations with patients about insurance freedom. Well, what would have to happen to make that possible? And we just reverse engineer it, and we create that goal action plan. It's just these, and then we flip it and go, okay, that's now number 1. And the first thing you said is number 10. And then we just list it down, and they just have a goal action plan page. They write some things down, and now it becomes accountable every single month, to every 2 weeks to that target. My coach, who does high performance coach, which I have translated into what we do, he coaches, Olympic athletes, Major League Baseball players, all this kind of stuff, CEOs. His performance coaching is required to be every 10 days. And so it could be 7 days, but it could be as much as 10. And so they're on a constant connection for accountability for those people. All right. And every single thing that they do is that ladder is a small step. It's just one small step every 10 days, one small step.
So let's not gloss over this. You have a coach.
Mm-hmm.
I have a coach.
Mm-hmm.
And we are coaches.
Mm-hmm. Yeah.
Right. So it's not what I love is I admire people who practice what they preach. And that's something that as a successful clinician, I wear that as a badge.
Mm-hmm.
I mean, I know what it takes. I did it. There are so many. I mean, you ran, was it your father-in-law's practice?
Mm-hmm.
Right. I mean, you know what it takes.
Mm-hmm.
There are people out there, and you and I know them, some of them, who maybe didn't quite do what they're preaching other people to do. That's
Mm-hmm.
a there's a big thing in the academic world, the those who can do, those who can teach.
Yeah.
And having lived in the academic world as well,
Yeah.
many years, there's something to that.
Mm-hmm.
I had a I won't mention names,
Yeah.
but he was the editor of the Journal of the American Dental Association, and we sat on a board together, and we were talking about a diagnostic test, and it was a diagnostic test that I happened to have done in my office, and he was saying there's no data that supports the use of this diagnostic test in formulating any treatment plan.
Mm-hmm.
So I couldn't quite get him to understand, because he's never been in clinical practice.
Mm-hmm.
He never had to convince people
Mm-hmm.
of anything. He taught, he pontificated. The reason I did the diagnostic test was not because my treatment plan was going to change. It was because I needed to convince the patient that the treatment plan that I knew they needed anyway, I needed a sort of
second opinion,
a third party corroboration.
Exactly.
A second opinion.
Yeah.
That's the value of, periodontal probing.
Mm-hmm.
And showing people, when you have the digital systems like the Florida probe, where it shows everything, it prints everything out in color, and you're able to show people a printout. right? That
Yeah.
printout is usually valuable.
Yep.
But this doc just had no idea
The value
of
of that.
what it really takes
Yeah.
clinically to convince people to go through things. That's one of the reasons, by the way, that most dentists have such, how can I put this nicely? I won't, such poor treatment plan acceptance.
Mm-hmm.
Because in dental school, they're taught the wrong way. They're taught it's all about educating the patient. Well,
Mm-hmm.
there's a component to that,
Mm-hmm.
but the education just can't be intellectual. It needs to be emotional.
Yeah.
So that's not taught.
Yeah. Yeah. The thing that I'm getting out of this, to maybe summarize, is think about dentists from a clinical desire to attend clinical CE and to master their craft. There's three parts of being a business owner. We talked about this, right? The artist, right? That's the clinician, the entrepreneur, and the leader, the manager. And so if you're, spending all of your CE hours and getting coaching in your clinical CE here, you're missing a two-pronged part of you as a business owner to say, okay, where's my CE? Where's my coaching in this realm? Oh, I'll just hire an office manager and a bookkeeper, you know, and what sort of training have they had to lead your team? So it really does take that seminar or CE or coaching effect in all three realms to run a successful practice. So,
So not just to run a successful practice, but
mhm,
I just got off a Zoom meeting with clients,
mhm,
and they're growing significantly.
mhm,
And um, it's really rewarding for me to watch this, and to help guide it. And when you go from a small practice and grow it to a bigger practice, you need to do it in a way that helps you avoid some of the pain of doing it organically, right? So I've been able to coach them in, because most dentists start off in a relatively small office.
mhm,
You know, communication is easy. You
mhm,
lots of things are easy. But as you grow, so I'm a student of the scaling up system,
mhm.
which was sort of the precursor to, I guess, what is more popular now, which is the EOS,
EOS, yeah.
right? Um, Scaling up and traction, both excellent books.
Mhm,
And they also talk about coaching,
mhm.
because
They
why not?
have their own coaching
They have,
divisions. That's what they
yes,
do.
yes, they do. Um, so I've been able to help docs, practices, um, stabilize, optimize, maximize, and expand. So a four-step
Mhm,
process. And most dentists, and it's a cyclical process, because as you're always stabilizing, you're always optimizing, you're always maximizing, and maybe you're always expanding,
mm,
right? And how do you do that if you've spent your entire career learning the technical parts of
yeah,
the business?
yeah.
What about, you talked about, sorry, I
Yep.
still have this little cough. Um, what about the human part? You talked
Mhm,
about, oh, okay, I'll hire a bookkeeper, I'll hire an office manager.
mhm.
Um, who's going to train them,
Yeah.
right?
You have to know all the aspects of your business and your leadership. You have to know those things. And if you don't, you're running the risk of someone else making decisions for you. What's the statistic on embezzlement in dentistry? It's something crazy high. I can't remember the number right now, but it's very high.
I think it was more than 75%.
That's at some point in your career, someone will have embezzled from your practice from you.
I think I heard something like 90%.
It's crazy high. I know that. I've seen different numbers, but all that to say, if you don't know what's going on with your business, you don't know how to lead, you're obviously going to be more susceptible to that. And there are steps, I've covered how to, done a talk on how to prevent all that from happening and understanding what's going on and the dollars that make that possible for teams. But if you don't know what you're looking for, because you don't know how to run your business, you're going to run into problems. So let's circle back to goal setting and New Year's resolutions. So for this year, what would be your coaching advice for those thinking, okay, what do I really want New Year's resolutions? Do I want goals? What am I doing here? What's the starting point?
So I do like to use numbers.
Yep. Measurable.
Yeah, absolutely. So I want, if I'm coaching the owner, I want to know what the owner wants to make.
Mm-hmm.
Not the practice. I want to know what the owner wants to make.
Mm-hmm.
I want that number.
Yep.
Because as you pointed out, a lot of factors going in the world that eat away at our profitability. And you could wind up growing your practice and not growing your bottom line.
Mm-hmm.
So I want a solid number
Mm-hmm.
of what that should be. And I like to see growth every year.
Mm-hmm.
So if your take home was $300,000 this year, I would minimally expect it to go up to 330,000.
10%. Yeah.
At least 10%. Because this way, at least you're factoring in inflation.
Mm-hmm. Yeah.
Now it may be more,
Yeah.
that's one you have to know about that person. Maybe that person hasn't saved any money for their pension, for their retirement.
Mm-hmm.
So they have to actually make more, right? The sooner you start stocking the money for your pension, the better.
Yeah.
Right. So at least 10%. And like you said, then we work backwards.
Yep.
Okay.
Reverse engineer it. Yep.
What does that mean? What's your overhead now? So I know you coach to keep a good eye on overhead also, right?
Mm-hmm.
So what's your overhead? And what do you have to generate collections wise?
So let's do that. Let's just use a real example. Let's say it's $1 million practice. Maybe it's just shy of $1 million. Okay. $1 million practice. Okay. And the doctor last year made, we'll say it was 270. Okay. But now the doctor wants to make 300,000 out of that million. Okay. So $1 million practice and the doctor made 270 and team's getting paid their 25% of that, whatever that number is, depending on geographics. So they're getting their 250,000. Okay. So the goal is 10% growth. Okay. And they want to be at $300,000. Okay. Annual income. And team members that are watching this, you can reverse engineer this too, by the way. You could say, okay, well, what do I want my income to be? You do the same thing and figure out how to work smarter, not harder. That's a different coaching topic. And their overhead is, I don't know, let's say, you want to say 65%. Let's say it's at that top place. Okay.
I'm in New York. The top is a little
yeah, more expensive than that. I think average say 65%. Okay. So that means total expenses are at $650,000 a year for $1 million practice. Try to use round numbers here. Okay. And they say, okay, I want my overhead dollars to stay the same. I don't want them to change, but I want that bottom line down there at the bottom. I want that to go up 10%. How do I do that? What's a simple way to reverse engineer that?
So that brings us to the reason that so many of our clients want to get out of insurance,
Yeah.
because there are three ways to increase your business. You can see more patients,
Butts and seats,
right? You can be more efficient,
more dentistry per visit.
and you can raise your prices.
Got it.
And insurance takes the raising your prices off the table.
Yeah.
And that's what frustrates a lot of doctors today.
Yeah. That's why we've seen a flock of people coming to ask us for help in doing that.
Right.
Never.
And
Yeah.
what's worse is that inflation and overhead is eating away at the rest. So your costs are going up at the same time that
Yeah.
your income is being
Suppressed.
yeah.
Let me ask you a question. Somebody's listening to this. They're saying, okay, so if I want to collect, if I want to earn, go from 270 to 300,000, which is a 10% increase. Do I just need to increase my collections by 10%? Is that as simple? So how does that math work?
So you have to reverse engineer it,
Yeah.
right? So and it's all based on your P&L.
Mm-hmm.
So you have to look at your P&L and see what your percentages are in different areas, evaluate them. Um, you should be able, hopefully you're working with an accountant who's able to give you what those norms are, or
Mm-hmm.
I'm sure you know what those norms are, right?
Yep.
Um,
So your dental expense guidelines. So we have those percentages that say, all right, you should be somewhere between 25 and depending on the area, no more than 30% for team overhead with taxes and everything. Like, how do you get there and how do you break that down? So here's the funny thing. If your collections goes up 10%, then your team members dollar amount is going to go up. The percentage is going to stay the same. So I was paying my team 250,000. Now I'm going to pay them, right, $275,000 a year, because that's going to go up 10% too. So the dollars go up as that goes up. So down at the bottom, that math that shows up. Yeah.
so it might go it might go up more, because what is one of the ways
Yeah.
most teams want to solve that busyness problem?
Add
Hire more
hours, hire
people.
more people. Yeah. Yeah.
And what
Volume.
is that? And they don't understand how that impacts
Mm-hmm.
those percentages and the profitability.
Yeah. Like I've got an office that she'll produce on her side. She'll do, on her own, 135 to $150,000 in production on her side, with 1 to 2 assistants up front, 1 to 2 admin, and 1 hygienist. Very, very small team. And they're producing $150,000 a month plus, right? Maybe 170. It'll fluctuate more with that type of practice because of large cases. They're not running patients through. She's doing that on 45 patients seen a month. Half the average dentist at 110 maybe. So why? Well, it's its style, it's the vision, it's how they practice. She's doing full mouth reconstruction. And we have several clients like this. But what most people think is, oh, we just need more patients. How do we get faster? No, it's not necessarily about that. It's about efficiency. So how can someone guarantee that, okay, I'm going to see 10% growth at that bottom line of going from 270 to 300,000 in earnings? Is there a way to guarantee that? Can you guarantee that's going to happen if we grow 10% up here? Or is it like, hey, you got to grow at 20% in collections, or you need to see 30% in collections to grow because these things need to happen? Or is it different for every client?
It's different with every client, because
Yeah.
it's how you guide your growth.
Mm-hmm.
So what's the growth going to be like? Is the growth going to be, I'm getting rid of my HMOs,
Mm-hmm.
and I'm going to be getting more fees?
Mm-hmm.
um, is it going to be, well, I'm going to cut my lab expenses by bringing stuff in house? Um, every practice is different, and that's the challenge.
Yeah. Yeah. So I put them in different categories. I almost have like plateaus when I look at a client, and I don't tell them what plateau they're at, but I'll look at someone struggling to get to 50,000 a month. My target for hygiene, I can pretty quickly go, all right, look, every day of a week of hygiene you have is equal to about 5,000 a month. So a 4 day a week hygienist, about $20,000 a month. And that's going to be give or take depending on the area and all that. But that's like got to be there. And when I see that number suppressed, immediately I can go, insurance is really creating a problem for you because your passive income is gone. You're giving everything to your hygiene department. And so there's this plateau, this ceiling that they hit where the doctor's like 33,000 a month and the hygienist is at 20 and there's one hygienist and they're barely filling 4 days. And trying to get that practice to the first plateau, the first level would be $1 million practice, 83,000 a month. And how do you do that? Well, there's room for butts and seats. There's room for two hygienists. There's room for growth, but there's also room for efficiency on case acceptance and the verbal skills you use and the efficiencies of what you schedule and all those things. And so what would it take to make that possible? Because this long list of things to do. Whereas someone who's already producing 1 million to 1.2 million, it's a different looking practice. Now it's about removing inefficiencies with cancellations. Now it's about removing the restrictions of insurance because you're not dependent so much on them. You have a little bit more leverage. Now it's about, do I see myself as expansion into butts and seats with associate, or do I see myself expansion into case size and full mouth case acceptance and clinical expertise? And that's the next plateau to go from that 1.2 to, you can see it go from 1.5 to 2 million pretty quickly. It's easier to go to 10x than it is 2x thing. And so you're right. Every practice is a little bit different depending on goals. And every practice has their fears, their struggles, their challenges. They're just different. Some is like, how do I pay my team? And some is going, I need to find patients right now because I'm not getting enough patients at this dollar amount. And so everyone's different.
So that's one of the reasons. So you said something again, we say things sometimes we don't even realize the importance of them. Fear
Mm-hmm.
is huge in the dental industry.
Mm-hmm. Yeah.
Fear.
Yeah.
What if? Catastrophizing things. And that's why I think it's so important to go through the process of not only having a dollar amount, but when I have that dollar amount, what does that mean to my life? What can I do that I might not have been able to do before? And really solidify that vision of that goal and what it's going to mean to you, because that will help you take care of the fear of doing what you need to do to get there. So you're moving towards something, right? Rather than away from something.
Yeah. Well, and that's the steps, right? That's the performance ladder. I just shared a post by Erwin McManus, and he was talking about how most people spend so much time and energy thinking about all the negative things that could happen if they do something. And he said, what if you just shifted and said, hey, what if I spent that same amount of time, energy, worry on thinking about all the positive outcomes that could happen if I make that decision? Why are we so drawn to this fear or this negative side of things?
And that, again, the value of coaching, because sometimes you can't, it's a head game. Mm-hmm. And that, I did you see the 60 Minutes interview with Djokovic?
The tennis player?
Yeah.
Yeah.
I
think I've seen bits and pieces of it where he's talking about this sort of thing, the mental toughness or something like that. Yeah.
Right. He corrected I forgot what the interviewer said, but he said, I beg to differ. It is something that you can train on, just like you train on the skills.
Your mental toughness.
Your mental toughness.
Yeah, absolutely.
And because you get it, it's the recidivism. We've all been in places where we were scared of stuff. And that's the value of having a coach that will help you.
Yeah. Yeah. Charlie, Yeah, are you watching Tiger Woods, Charlie Woods? Are you seeing any of this? Tiger's like just constantly berating him while he's performing, like
I
saying negative things to him, and they're like, "Why are you doing that?" Not constantly, but he'll like give him a hard time about things just because I'm going to be the easiest one on him. This gallery, these competitors, the announcers, everybody's going to say, and if he can handle what I'm saying to him, he'll be able to handle all of those things later on. And it's about mental toughness. Now we're using sports analogies. But it's the same when you're thinking about goals and vision. You're thinking, yeah, it just seems greedy, or I don't know. People will think I'm making too much money. I mean, I imagine people hearing this, like, you know, I don't know. I think there's some dentists that'll go $300,000. I mean, I think the average is like 154 or something right now. And I think they're going, oh my gosh, 300,000. I think there's some dentists that are going 300,000. That's come on, like that's not where you need to limit yourself. And I think sometimes we create, John Maxwell calls it that law of the lid, that glass ceiling we put in place where we can't actually allow our minds to let us see and envision how great it can be. Now, you don't need to be unrealistic with it. You don't need to get all crazy. But I think that providence of movement, of initiation, and saying, I'm going to initiate this target by communicating it with someone, a coach, someone who's dear to you, writing it down, all of that, I think takes precedent. I think that is how you can start getting some mental toughness. And every day, create the habit of the moment I wake up, what are my thoughts? The moment I wake up, what am I initiating? And if you need to grab something, please don't grab your phone unless it's a note that says, or on your lock screen that says what you're supposed to be doing. The first thing you see is a lock screen that says, this is what I'm going to do. Or your gym clothes are laid out, or your Bible is there. Or for me, I listen to 2 songs on my playlist every day while I'm getting ready, right? There's got to be something that you do to initiate the day. Habits are so helpful when it comes to follow through and commitment. So without habits, your systems will fail.
Yeah. So you mentioned the book Atomic Habits.
Yeah.
I have it here on my shelf,
Yep.
actually,
Yep.
right over here.
Yep.
Um, and those, again, what you reading is just another way
Mm-hmm.
of coaching
That's right.
yourself.
That's right.
So the books that you read, the videos that you watch, the information that you are allowing to come into your life
Mm-hmm.
has a huge impact on that mindset
Yeah.
we were talking about that's
Yeah.
sometimes so hard to control.
You'll self-sabotage yourself. You'll write this New Year's resolution down, and I'll keep it really basic since we're 10 pounds, or I'm going to go to the gym, or whatever it is. You'll write some things down, but in your mind, you're saying, I don't know. And then you start just come up with excuses and reasons why it doesn't happen. Start talking about reasons why it will happen. Start changing that mindset. Nothing positive ever comes from something negative. It's almost impossible to do. I think we get lucky sometimes. I lost that job and it turned into this job or something like that. But negative mindset isn't going to create a positive outcome. Negative conversation is going to be really hard to create a positive outcome.
So I have a little different take on that.
Mm-hmm.
So I think that there's a lot of positivity that can come out of negative things if you have the right perspective, and especially if those negative things happen to somebody else.
Mm.
So how often do you say, well, I don't want that. Oh my God. Yeah, I don't want that happening to me.
It'll
Okay.
educate you. Yeah.
Right.
Yeah.
So I
Yeah.
think it's all, again, it's a value of how you're thinking about
Yeah.
things. Turning a negative. Look at Michael Jordan, right? Michael says that part of his success is the fact that he got
Got
cut off
cut.
his,
Yep.
his high school basketball team,
Yep. Yep.
right? And he needs to prove it. So that's an individual thing. Not everybody thinks like Michael Jordan.
And I think the actual way I should say it is 2 negative things connected will be negative plus negative can't equal positive. It's got to be negative plus a positive reaction. Well, it's like math formula, but the positive wins instead of the negative winning. So, because success and failure are intertwined. We talk about this. You're going to fail your way to success, but it's how you respond to the negative. It's how you respond to the challenges. So, yeah, 2 negatives won't equal a positive. That's really hard to do. Negative thing happens to someone, you go, oh man, I hope that never happens to me. And oh, it probably will. That's coming for me. Everyone's sick right now. I'm probably going to get sick too. I better not get sick. And what's the word you keep saying over and over internally is sick, right? Instead of saying, you know what, I'm healthy. I am healthy. I am healthy. God wants me to be healthy, whatever it is, right? Just keep communicating that internally. And I think there is some mind over matter that happens. And I definitely think there's some weak mindedness that allows failure to show up. When you're weak minded, it's really, really hard to see through those negative things. You just let it spiral and down you go. Yeah. This is good. This is good. So I'll give it the two questions again. So what would it take to make 2024 ideal, and what's going to happen? What has to happen to make that possible? And start listing out all those things. So what's your ideal 2024? Boom, boom, boom. Maybe list 3, 4, 5 things at the most. And then under each one of those, what would it take to make that possible? What would it take to make that possible? Keep digging deeper. And then share that with someone. Get into coaching. Share it with someone to make that possible. There's got to be accountability to it. All right.
And get a number in your head.
Yes, measure it. Make it measurable, make it impactful, make it something that you know is attainable. So I use the smarter goals analogy, right? So specific, measurable, attainable, written, realistic with a time frame. But then ER, evaluate it, constantly evaluating it, and then R, readjust or reward. Have something that you celebrate with. What will this do for you? I already know when I hit my goal what my reward is. I'm very excited about this reward. And I won't share it here, but I'll share it later. So my love language is gifts. So I will gift myself something.
So I did it. I'll
Yeah.
tell her. I'll tell everybody.
Yeah.
So I only fly first class now.
Yeah. That's your reward. Yeah. Once you hit that target, you're like, okay, I'm going to fly first class all the time. Yeah. It's something that you treat yourself with. Yeah. I collect things. So, yeah. So it would be just a part of, something that's totally frivolous that I wouldn't buy on a regular basis. So, yeah. But yeah, I think you have to have big rewards. And I also think you have to have every 7 day a reward. I think you have to have something you say, man, I am working my way towards that. And here's my reward. Could be simple things like going out to dinner, date night. It could be guy night, hanging out with the fellas, ladies night, whatever it is, for me, sometimes it's just let me have a chai, it could be little tiny things. It doesn't need to always be big things. So yeah.
That's great.
Well, now you've given me a target, first class. I fly Southwest a lot. There's no first class. So you New Yorkers, you got your Deltas and your Uniteds and your Americans and all of that. What do you fly?
So I fly out of Newark most of the time. So it's a United hub, unfortunately. Yeah. So I have status. We can talk about this, by the way. This is a great topic for next time.
So next month's topic is what?
Status.
All right. Status. All right.
Status matters.
Okay. First class. Status matters. All right. That'll be our topic in the new year. So challenge yourself. And if you're watching this, you can also put a comment on the video. You can comment on there, put your target, create some accountability, really put it out there. Comment on social media posts, message us, email us, whatever you want. And we'll be your accountability partner to it, your coach. Awesome. Thank you so much, Dr. Goldberg. Happy holidays.
Namaste.
All right.